I'd like to welcome you to the Super Morning Show this Monday morning. My name is Melvin Stewart. Let me introduce my guest this morning. They come from the St. Joseph Catholic Hospital, and of course, they are in presence of Dr. Best Daba. He's GYN specialist, of course. Mrs. Lofty Dino. She's a midwife, and that of Miss Gifty N. Gray. She's the public relations officer at that hospital. I'd like to humbly and respectfully welcome you people this morning to the Super Morning Show. I will just start with you. Introduce yourself, then we go across, please.
I'm Miss Gifty and Great PRO of St. Joseph's Catholic Hospital.
Okay.
And that the best DAPA, OBGYN specialist assigned at the St. Joseph Catholic Hospital.
Okay. Let me hear from you.
I'm Lofty Meon Dino, a registered midwife at St. Joseph Catholic Hospital.
Let me just start with the public relations officer. She's the official spokesperson of that institution. How is the hospital?
The hospital is doing good.
In terms of what?
In terms of our activities, seeing patients, treating patients, I think everything there is okay.
That's good. All right, we start the ball rolling like this. This thing about fistula is an household name all across Liberia. I can recall when I was right there around my place in Phoebe. We had the biggest fistula camp there. What is this fistula we are talking about? Every time fistula. That.
Right. So, first of all, fistula just means communication, between two systems, body systems, or maybe between two organs. But we here today will be focusing on the urogenital fistula. So especially ones that usually result in or that happen in women. So when we say the fistula, usually that happens in women, communication or opening between the genital system and the genital urinary system, that is maybe between the vagina and the bladder, or the bladder and the urethra, the place people come from when you leave the bladder, or the place people can even empty to come to the bladder, the urethra and the vagina, or opening between the genital system again, the vagina, and the gastrointestinal system. That is, sometimes it happens with the rectum, so what they call the recto-vaginal fistula. So there are several fistula all across the body. You can have it in intestine, you can have it in skin, you can have it in heart, but mainly we are focused on commonly known as VVF, the vesico-vaginal fistula. That means the bladder and the vagina are communicating. There's an opening there which is not supposed to be there. So what usually results from it has several causes, but for our part of the world, it usually results from obstetric injury. So when we say obstetric injury, people that have stayed long in labor, so what we call prolonged obstructed labor, where a woman goes to give birth and then she overstays the normal time she's supposed to give birth. And this happens mainly in underdeveloped countries, but not to be too harsh, we say in resource limited countries, because in these countries you have a lot of people with low socioeconomic status, that don't have access to health facilities that have got the requisite or trained personnel to recognize these things early and then intervene appropriately. So some of the interventions usually can be surgical, or then something we call through the assisted vaginal delivery. So if you don't have these things available to these people, that the only most of these folks around, in the counties, in hard to reach area, they go when they're in labor, they go to a traditional midwife we call the TTM, to the homes of these midwives. Sometimes they go to clinics that haven't got any or trained doctor there, or any trained nurse, or somebody to do surgery that doesn't have any theater. So when these things happen, they are referred to facilities that can do this, that can make these appropriate interventions, and sometimes the distance to get there. So those are some of the delays that we look at. Even sometimes for the people themselves to take decisions to go to the hospital, and then the time they take to get there again is another challenge. So when that happens, the baby stays long on his way, compressed down. The fetal got bone now, the skull got bones, and then the maternal pelvis, the place the fetus passes, it has bones. So when the baby is compressed, it's compressing rather the maternal pelvis. So the organs are right there. So you have the baby here compressing the maternal pelvis, and these organs are between them. So what it causes, it stops, usually blood from going to these organs, and then they suffer from necrosis. I mean, they die, and then they tear,
Hmm.
and then there's an opening between them where you have now woman just start to urinate on herself. So usually that can happen. You start to notice that maybe if the person delivers now 24 hours, sometimes even up to 2 weeks, then the person comes to the hospital and tells you that, okay, I just urinate involuntarily, okay, I just pee on myself. And then sometimes if it affects the rectum, and the woman will tell you that she just poo on herself. So
I'm here to know, and I guess others out there want to know as to when did we as a country realize, especially from the cycle of the health ministry, when did we get to know that fistula actually exists?
it's been in existence forever. Uh, the the challenge has been having personnel to address these
Yep.
situations,
Okay.
or in as much as having personnel to address this situation has been a problem, they can be prevented. And some of the ways we can prevent it are what I stated earlier,
Yeah.
that making uh, health uh, accessible, to the population as a whole. So making health facilities, having many trained personnel. So those are ways it can be breached, it can be prevented. So
Okay.
that even if it happens now, we'll get to the treatment. That is why the team from France, the Archimedes. So that is why they're bringing some professionals. I think a team of 3 doctors that are trained to do the surgery for the fistula, usually called it the fistula repair.
Okay.
They're coming now to help our people.
Okay, let me speak with the midwife because you people are the ones I normally come in contact with the victims of this fistula. How how do you feel as a midwife coming in contact with somebody suffering from this sickness or this health complication? And what do you do professionally as a midwife?
Okay. First, you feel very bad because normally a woman to just pee on herself with that smell, you don't feel good going among your friends. And for a woman to go through delivery and coming down with those problems that is just happening to her spontaneously, you feel bad. Especially if that's the midwife that conduct that delivery, you feel so, you put yourself in the shoe of that patient. If this were me.
Mm.
So this is why we as a midwives, we are always, the Ministry of Health is conducting of training for people to go there and get knowledge on those things. Like what Dr. Best said, if you notice as a patient is going through labor for a longer time and you are in a clinic, you refer the patient to bigger hospital to avoid this fistula. Because if you just keep the woman there and then she go through that longer period of labor, at the end of the day, that baby will come out. But that lady will come down with a complication that she will forever remember and live with it. And those conditions where you got it, your partner even neglect you for that. Because you just pass it every time you have to be changing pad. You change your pad, you go among your friends before you go, you have to prop yourself up. It make you feel uncomfortable. So we feel very bad when women deliver and come down with that condition.
What is it that is it only women who are pregnant who get pregnant, or you have teenagers coming down with fistula? Because, like I said earlier on, in Phoebe, the Fistula Center there, most of the people I saw there at the time, 3 years ago, were just young girls coming up. And what leads to them coming down with fistula if they have not bear children before? Or yes, of course, they have not got impregnated.
Yes, some of it can be through rape.
Okay.
That is, they were forcefully raped.
Mhm.
Because like that, the vessel have to be connected, right?
Mhm.
With the vagina and the rectum. So if they are not bear children, some of them it can be through a rape.
Yep. Just to add to that, if you see most of them, the teenagers having that problem is it's typical for them to have it. So you see, usually this thing happens to people that get pregnant for the first time. So if you're pregnant for the first time, your pelvis hasn't been tested. So usually, especially, it's even worse when you're a teenager because your pelvis now isn't even well developed. For all the mechanisms now for child to come and navigate through. And then sometimes your pelvis is even small, and the child too has weight. So those things come into place. When a woman is pregnant, you have to look at three things when she goes to deliver. The passenger, we call it, that is the baby, so the size of the baby. So if the baby is big, then we look at the passage, where the baby passes. So it depends on how well that woman's pelvis is formed. So if you find that in teenager the pelvis isn't even that, adequate yet, especially for the kind of type of pelvis that you need in women, the teenager hasn't, in that teenager hasn't been formed. And then during delivery now, there are other factors. So when you find most of these teenagers having, it's difficult in them.
Okay. Before I come to the public relations officer, uh, looking at the repairs of people who come down with fistula when they have been repaired medically, is it possible that they come down again for the second time with the same fistula?
Yeah, it's very possible. So you see, the fistula too has got degrees. You know, according to the WHO, they classified it into simple and then maybe complicated, and then complicated are what it is. So if it's a simple fistula, usually if it's a one tear, because sometimes there can be multiple tears. So if it's only a single tear, it's good. And if the tear too, depending on the size of the tear, so usually if it's something less than a 4 centimeter, then it's also good. I mean, it has a better prognosis.
So it has severity. Fistula has
Yes.
severity.
So depending on the severity, when it's repaired, sometimes it breaks down. Sometimes it's not successful because sometimes if the tear is really wide, and then if that baby if that woman was in labor for a pretty long time, other surrounding tissues uh, surrounding that tear, they also become avascularized, or mean that no blood supply, so they're not very healthy again. So they also dead. So they even repair them. Sometimes they use something they call flap, take tissue from somewhere else to put it there to cover. So it's complicated. So sometimes it's successful, but then sometimes too it breaks down. It's not successful. And once it has been repaired unsuccessfully for the first time, it's even poses a more a difficult repair now the second time.
Okay. Uh, Madam Gray, you heard your professional health workers already, and we understand that you have a team of surgeons coming from different parts of the world. How did you, as a hospital, come in contact with them, and when do we expect them to arrive in country?
Okay, they have been our partners. This is not their first time coming.
Okay.
They always come to the hospital to conduct free surgeries. They are expected to be here from the 11th of this month to the 17th to carry out some free surgeries for people suffering with fistula
Which country are they coming from specific?
from France.
France. And how do you get people over to be treated, to form part of the surgery?
Okay, we stated that on our flyers. We have flyers on Facebook, which we encourage the public to share. Go on our hospital's Facebook page and share the flyers so many people can see it. We do radio announcement. So for people suffering with fistula, you have to make your way at Catholic Hospital. When you get there, you just tell the cashier or whoever you meet there, the staff that will be willing to help you to direct you to the cashier. Once you get to the cashier, you tell her that you are here for the fistula program. You get registered. We have a list where we will put your name down. The doctor will do few assessment, whether it's lab or what have you. And then when the team comes, we'll call you, place a call to you so that you can come for the surgery. But it's absolutely free of charge.
No
You're
money.
not paying
Okay.
anything. All you need to do is to pack your bag and come to the hospital to make use of this glorious opportunity.
How long does it take for one to be admitted at the hospital for after being after the surgery?
After the surgery, the time of
The time frame now.
so
It's
doctor will speak to that.
okay.
So usually we'll after the surgery we'll keep them around for up to 2 weeks.
2 weeks.
Yeah. Monitoring them, keeping the urinary catheter, the PP bag, so to speak. We'll keep it in place and then monitor them every morning, you know, keep them there around for 2 weeks.
Okay, and in during that time, you say you keep monitoring them. How how do you go about with your work as a surgeon? If you met somebody with the fistula and perhaps they've done all of their necessary checkouts and all the things, and they are ready for surgery, do you put them in a state where maybe they don't understand what's going on, what is going to happen to them, because
Oh,
many of them have the fear?
right. So the first thing when you encounter or you meet a patient,
Mm.
uh, and you take history from the patient, that means you ask, several questions, detailed questions about the patient's health and past medical history or what have you. So you get that documented, you assess your patient, and whatever diagnosis you come up with, coupled with the laboratory findings
Mm.
and your own physical assessment, you have to counsel the patient, which is very important. So if you diagnose a patient, whatever diagnosis there is, you have to sit the patient down, tell the patient what it is, make sure the patient understands the complications, and then explain in the simplest terms, what you want to do for the patient and the expected outcome. That is what you do. So going to the surgery, the patient will be fully informed of what to expect, you know, and then even the anesthetist too will come in and play their part, tell them. So usually in cases of fistula, they use something they call the spinal anesthesia. So the patient is not unconscious. The
Okay.
patient is fully conscious,
Fully.
or you only give it to make the the lower part of the body, you know, uh, not responsive to pain. So, but from the upper part, and the patient is well awakened, can talk, is fully conscious. So during the surgery, the patient can be having a pretty friendly conversation with you in the theater, and it relaxes them even better.
Do we have the requisite tools in Liberia, especially so at the JFK, to not JFK, but Catholic
Yeah, that's
Hospital,
right. Yeah.
the St. Joseph Catholic Hospital, to carry on these works?
Oh yeah, sure. The tools are available. They're pretty much available
Mm.
to work with. Um, the only problem we have is the trained personnel. So sometimes we have some local doctors that have been doing some successful surgery, fistula repair, but then we still need to have more doctors trained in that regard. And then the the team that's coming, usually these foreign teams to come in to aid with the requisite training now.
Mm.
They come and we have tools available that they work with comfortably.
With the limited or the trained man, lack of professional or a number of trained manpower to carry on some of these works, as a professional man, as a doctor, what is your plea to? what is your plea to the public or to those responsible for the training of medical practitioners?
Well,
Because
yeah,
one day you will not be around, and somebody needs to step in.
yeah. So years back, uh, before the previous government, there were a few doctors being produced, but now from the onset of the previous government that was doing Ellen's term, she instituted a measure that made a few more attractive, trying to produce more doctors. So it used to be 4 or 5 medical doctors being produced. Prior to that, maybe the highest number was sometimes 8. But then during her tenure, the school started producing up to 35, 40, sometimes even up to 50 graduates. So with the greater number of people being trained, and then after they shall have graduated, can the opportunities can be afforded them to go and further their training to abroad. Or then we also have an established institution here to further training to that's called the LCPS, the Liberal College for Physicians and Surgeons. So there are still improvements. There are gains being made over the past years, and then this government took him to power and build and try building up on the gains, even though there were some glitches or challenges to there.
It will
But
always be.
yeah, so that's the plea. So to continue on that footing, you know, train more personnel and then encourage that more people to get either you provide a year or go out and get the requisite training. So with that, you can be able to cater to the need of the population.
Let me speak with the midwife. Do you have advice as a midwife to adolescent girls across Liberia who, one way or the other, might come in contact with fistula, and maybe your kind advice to them could prevent them from coming down with this sickness?
Yes. So my advice to the adolescent girls is this whole fistula thing is about awareness,
Mhm.
giving
Awareness.
information. Like when you go to the various hospitals or clinics, they have health talk. People give health talk on these things, how to prevent fistula. So to advise them, you also tell them that because some of them when they reach that age, they are sexually active.
Okay.
So you have to advise them. This is why they got family planning all around. Because if they reach that age and they have active sexual practices, you cannot stop them. So you advise them if you are involved into this, it's better you go on a family planning because your body has not been developed to accumulate the pregnancy that will come if there's an outcome.
Mhm.
So in order to avoid it, get on your family planning. That will be able to go to school and reach that age that your body will be mature so that when you get pregnant, you will not come down with this condition.
Okay. Uh, Madam Gray, how many persons you think your hospital is expecting to deal with for this coming surgery?
50 people.
50.
Yeah.
Just 50. So if you had more than 50 persons coming, like 60 or 75, what will you do?
It's a rolling process. We keep them for the next mission.
And how do you do your surgical work? Is it on a monthly basis or is quarterly?
Let's say quarterly.
Quarterly. And bringing the do you bring the same kind of dieters from the same country, or you have other dieters from different parts of?
For this team, they are the ones always coming for this particular mission. Besides, we have other missions where people come from Spain for urological and plastic surgeries. But for the fistula, they are always from France.
Okay. All right. Let me very shortly. I'll open the line so that the public can interact with you this morning. That
Yes, sir.
and did I get the date of the arrival of the team? Did you say when?
December 11th
December
to
11th.
17th.
Okay, that so 11 to the 17th. So
Yeah,
6 days operations.
yeah.
Uh-huh. So the moment they arrive, meaning the operation will start.
No, they will come before that time, but that's the time the operation starts.
Okay. That what do you expect from this operation that is pending?
Okay, so we had and if the one was the surgery done in September or the
Um,
first one
the first one was in, I think, October.
in October, right? So we recently had one which was pretty successful. We had a total number of 25 cases. A few more added after the team came, and then after the number of surgeries, I think only four or five surgeries that had breakdown. So those patients too will be looked at, during this mission. So that was a pretty much good success rate,
Okay.
and we don't expect anything less. The team was pretty impactful, you know, and kudos to the local team on ground. They were there, we were there, matter of fact, and provided the necessary support. Uh, it went well, so we don't expect anything quite different from what happened from what occurred the last time. We expect it's pretty much the same success or even better one. Yeah.
Okay, well, listeners, my guests this morning are from the St. Joseph Catholic Hospital in Monrovia. We are talking about fistula. Um, my guest, Dr. Best Adaba, he's a GYN specialist. And Mrs. Lofty Dino, she's a midwife there at the hospital. And Miss Gifty and Gray, she's the public relations officer at the St. Joseph Catholic Hospital. Surgical team is expected from France there by the 11th this month, and they will be carrying on the fistula surgery at the hospital. If you are out there and perhaps you are experiencing something of that kind, of that nature, the invitation is yours, according to the public relations officer, not me. I'm quoting her anyway. So you can come over, and of course, you will see the team there that will meet you and they get all of your information. So, yes, the numbers to be a part of the discussion this morning. Perhaps you have some other recommendations you want to give out to the management team of the hospital. The numbers are 0880 514 0880 or 077 077 or 0886 324740. You can call these alternative lines. Let me speak with this person. Good morning. Good morning.
Yeah, good morning.
Morning, sir.
My name is Joseph Kistingwe. I come from Chilwell community.
Joseph, what do you want to say into this matter?
I really want to ask a question concerning that particular issue.
Mm.
Yeah, my uncle went through operation and right now he is up to he is experiencing such thing. So can he?
Go ahead. Joseph? Oh, okay. I think, okay, you can still call and let's talk. 0880 514 or 077 077 good morning. This line is giving me. Okay, good morning.
Hello?
Good morning. Please go ahead.
Yeah. I don't really get you, man.
Oh, I don't know what's happening. I think our technicians will have to look at this baseline. 077 Call me on these alternative lines. 077 or 0886 324740. 0886 324740. So that you can put forth your concern this morning. My guest, I going to respond to you. Just be clear and straight to the issue. 077 or 0886 324740. Come in. Let's talk this morning on the platform is the Super Money Show, and of course, my guest I from St. Joseph Catholic Hospital this morning. Okay, let me go to this line and speak with this person. Good morning.
Yeah, good morning.
Morning, sir.
Hello?
Good morning. Please go ahead.
Yeah, Saba. Yeah, I just want to ask a question concerning the men. Yeah, how can men get fistula and how can that occur? Yeah, you
All
got me?
right. Okay, thank you. Thank you. 0880, that's 0886 324740, 0886 324740, or 077 Good morning. Good morning.
Good morning.
Morning, sir.
Good morning.
Good morning. Please go ahead.
Yeah, I want to ask a question. I call you from Ghana, the money again, Bridge.
Okay, Rex.
I want to know what is the operation only limited to women.
All right. They jotted down the points. They will answer you. Good morning. Morning.
Yeah, hello?
Hello, Mama. How you doing?
Yeah. This thing that you're talking about, you can catch owner portion.
Where are you calling from?
I'm calling from Marshall Highway.
Okay. So what's your name?
I'm calling from Marshall Highway. You can catch owner portion there for the 5 years.
All right. They will answer you. Yeah, listen. Keep listening to the radio. They will answer you. 0886 324740. Let me talk to this person. Good morning.
Yeah, morning. How are you?
Morning, sir. How you doing? 0886 324740, 077 the numbers you can call and be a part of the program this morning. My guest, Dr. Best Adaba. He's a GYN specialist. Mrs. Lofty Dinah. She's a midwife, and that of Miss Gifty and Grady. All from the St. Joseph Catholic Hospital. We're talking about the upcoming fistula surgery. The surgical mission is expected in country on the 11th of December. And if you're out there, you have concerns, please call 0886 324740. But while we are with the calls, we will get to our guest to respond to the few concerns quickly. So, yeah, the concerns are there. I know you can just go.
Yep. So the first caller, maybe after a series of troubles with the line, one of the callers who got, the first one that we got clearly was, he says, how can men get fistula? From the onset of the show, we clearly said there are several other fistulas, which will not, fistula, which will not be concerned with today.
Okay.
We are mainly concerned with the one that affect women.
The women.
Yes, especially the urogenital fistula that usually results from obstetric injury, difficult labor, prolonged labor, obstructed labor. So that is our concern. So those are the patients we have this mission for, that we intend to help. So not the men this time.
But is it possible for men to come down with it?
With fistula? Chief, I just told you that there are several fistulas in different types of the body. So anybody can have it. They can have it in the heart. They can have it in the intestine. They can have it even in the skin. So there's several. Fistula just means two organs communicate. Or opening between two organs.
Okay.
So anybody can have it. But the particular one we are concerned with now is the urogenital, the vesico-vaginal.
The next concern.
So I think basically these callers had the same concern in a nutshell.
Somebody
The
asked.
second person said, "Whether is it only limited to women?" So we have already said that. And okay, the last caller said, "If it affects older person, 45-year-old, yeah, it affects anybody. We're just saying people that are at risk. It affects anybody. So usually 45-year-old, their level of fertility has decreased. They have long past the reproductive years. Even though we see some few women at that age getting pregnant, in Africa here, but the they're very few. So the people that are risk for this kind of this particular illness is people in the reproductive age, which is between 15 to 35. And usually the ones at the lower ends, the 15, the teenagers, we should say, because those are the ones that, will usually have problem with vaginal deliveries. But it can happen to anybody. People with, we say, low socioeconomic status. That is people that don't have access to health facilities. They live hard to reach area. They don't have access to trained medical people. So they don't have access to interventions like surgery, like somebody assisting them to deliver. So those are the kind of people that people that are going through what they call this genital mutilation, the female genital mutilation. That is one of the causes of fistula.
Okay, I will take a few more calls. 0886 324740, 0886 324740, 07759788530, 07759788530, or 0886 324740. My guest, I from the St. Joseph Catholic Hospital. We are talking about the FISTULA program. Of course, the FISTULA project, and the surgical team is expected shortly to come to Liberia. And so if you are out there and you want to form part of the discussion this morning, you can call on 0886 324740 or 07759788530. These are alternative lines. You can call and be a part of the discussion this morning. Okay, let me go back to my guest. Let me talk to this caller this morning. Morning.
Hello?
Morning.
Yeah. I'm Moses. I'm calling from Senator.
Go ahead, Moses.
Yeah, if the woman is pregnant and then they are not meeting with her boyfriend or something, they come anyhow for them.
All right, thank you. Thank you. They will address that. 07759788530. Let me talk to this person. Good morning. Morning.
Yeah.
How are you? I beg you. Hello?
Yeah, can you?
Wait, now you got radio loud behind you, right?
I already left the radio.
Okay, please go ahead.
Yeah, I want to ask the doctor, you see the way children can get it to for 15 years, we are not born yet, and I want to know the symptoms of it.
Maybe just joining the radio, but okay, but they will answer that. They spoke about it. They spoke about it, and of course, but they will address that concern. Good morning.
Yeah, good morning.
Please go ahead.
My name is Sam Ellis. I'm calling from 12 zone. I want to know, because you didn't mention whether anybody who has something called Iguanian hernia, you can also do operation for them.
Okay, thank you. Thank you. 07759788530, 0886 3247 0886 324740, or 07759788530. You can call and ask a question this morning. The guest I still here listening to you. Let me talk to this person. Good morning.
Yeah, good morning.
Morning.
This is Patricia.
Patricia.
Yeah, I want to ask a question. Somebody get certain problem concerning carry to see, like to the person vaginal again now day. People can be able to take it off.
That fistula we're talking about here. Anyway, thank you. Yeah, they will answer you. Yeah. Okay. It's a concern in a way. It's a medical concern. Let me talk to this person. Good morning. Good morning. 07759788530, 0886 324740, or 07759788530 are the numbers you can call and be a part of the presentation this morning. Okay, but while we are with the calls, we can speak to that. Okay, let me take this person quickly. The band on the line. Good morning. Good morning.
Yeah, good morning.
Morning, sir.
How you doing?
I'm okay. Please go ahead.
Yeah, this is Mr. Bro from Sino.
From Sino, let's hear you.
Yeah, thank you ever so much. I just want to ask the studio guest as to whether there will be outreach for the issue of the fistula and other maternal health conditions that they actually addressing. Because being in Monrovia will not also help the entire population of Liberia. So we are also asking as to whether there will be outreach conducted.
Okay. Thank you. Thank you. Taking the surgical team to the people is a concern. 086 324740 0775978530. We can take we can our we can you can still call on our baseline 080514096. If we can get you, then we will let you will speak to the public. Okay, let me speak to this person. Good morning.
Good morning, sir.
Morning.
Yeah, I'm Jerry Towa. I'm doing from Omega Community.
Go ahead.
Yeah, I want to know concerning about the family planning. I want to know that if the family planning is good for women as well as children who have not yet born, or who have not yet born yet.
Okay.
But it is good for them to continue taking it.
But we're talking fistula here now. We're talking about fistula. Okay.
Yeah, but we're also discussing about health issues also.
Okay, brother. Thank you. Yeah.
Okay.
Thank you. Thank you. Let me talk to this person. Good morning. Morning. Good morning. Good morning. Oh. All right. Let me get to the guy. Guy, you can respond. Maybe we'll take our final batch of callers, then we will conclude the program. Just go ahead.
Right. Okay, so the next question was if a woman is pregnant and she's not mating with her partner, what are the causes harm? So those are health, health education that we encourage. Once a woman gets pregnant, we encourage a partner, bring the woman to the hospital. So all these things can be discussed right there. That's why we have the midwife there. They do what they call the health talk or pep talk every morning. So if you bring your wife to the hospital, all these things will be discussed there. We say pregnancy is not an illness. So a woman can be pregnant and she can go through her normal life. So which is sexual intercourse is part of of livelihood. So she is supposed to have one. Right. The next caller asks if 16-year-old can get pregnant, not pregnant, but if 16-year-old can get the sickness, the fistula problem, without getting pregnant. Yes, it's very possible. So fistula doesn't only result from obstetric injury or from difficult delivery. Sometimes if there's an issue with a patient, because even in the developed world or places that I would say resource-rich countries, most of the fistulas are not from obstetric injuries. The fistulas result from surgical procedures, and maybe some people go with fibroid growth in the womb and you go take it out. Some people even from the C-section, during delivery of a child, or some people who are taking out the whole womb or got hysterectomies, and that too has got several degrees. So depending on what you're doing for the patient, they can come down with fistula. Also, the midwife Lofty, she mentioned earlier, victims of rape. So maybe a child was raped, and the person can have fistula. So we mentioned too again earlier the genital mutilation. That's pretty much a surgical procedure too. So if the person is not skilled or even the reason they're doing it, the child or the individual could be affected. So one does not have to be pregnant, before having this disease. It results too from other causes, and the symptoms is just pretty obvious. So a woman will come and tell you that she urinates, she just pees on herself. So I just pee on myself, wow, so I'm feeling peeing, I just calm down. So urinating, involuntarily is it's a clear symptom that has to be assessed and appropriate diagnosis made. So another question was if the person has a swelling that he called a knot on the vagina, if we take it out. We do that at the hospital, but that is not for the mission. So if anybody has got one, that patient is not captured, for this mission. But doing our regular services is something that we see on a regular basis. So if somebody has that problem, they're always welcome, or she is always welcome to the St. Joseph Catholic Hospital, where she will be assessed and then managed appropriately. And then the last question was whether there was a person called from Sino.
Sign.
Yeah, he point is pretty valid. Whether there will be outreach for fistula surgeries, fistula repairs in the counties. So the team, might not have the capacity, or they're not planning to go in each county. It's almost impossible to go in each county. So our PRO will even speak further to that, but they've done a gesture, a very good one, that no no matter how far you stay or how far, how far you live, you can always transport yourself, come back after the treatment, everything. There are funds provided for you that will cover your expenses, especially transportation to and fro. Will give you back the money. So that is how much willing the team is to help, the Liberian people. So whether you're in Sino, and if the team cannot come to you, you can always make your way here. If you have some financial constraints, that can be handled later on. But the PRO can
Yes.
further
So
take it.
yeah.
So we are doing outreach in at least 4 counties. This team here will cover Monserrado and
Mikey.
Mikey B, and the other team will go to 2 other counties. So we have our team there. We are carrying flyers, we are carrying banners, we will do publicity in a markets on markets day. So we are going to do the outreach. We are visiting clinics, government clinics, and what have you to get people that are actually suffering from this condition.
Okay. Okay, I can take the last batch of callers. Then we conclude. 0886 3247 Good morning. Good
Good
morning.
morning.
Good morning.
LBC?
Yes, sir.
Okay, good morning. I'm ST Young. I call from Monrovia, NTA area.
Mm-hmm.
My question had to do with what is a GM specialist and who is a GM specialist?
You say what?
What is a GM? I hear somebody
Oh,
say they are
okay.
a GM specialist. I say, what is GM specialist and who is GM specialist?
Okay, GYN
Okay,
specialist.
GM specialist and who is that person?
Okay.
I mean, their function. Thank you.
Thank you. Thank you. He's here. He will talk. Anyway, it's a good concern. 077597853. Okay, another person. Morning.
Yeah. Yes, morning.
Morning.
I saw the Iranian money, but my answer was located.
What you say what? Eh?
Hernia. Iranian hernia.
Okay. But we're not discussing honey here. Yeah. Please. They got people who are specialized in different kinds of health issues. So I'm not too sure. Those responsible for that are in studio. So yes, they will take your concern back to the hospital. Yeah. Thank you. Thank you. We just need to stick to the discussion. Hello. Hello. Yes, sir. What's your name? You say your name? From where?
I'm calling from around Benton Hospital.
Go ahead, sir.
Okay. My question is, I want to know is that I have a nephew that falls from a pantry, and since that he has had a spine problem, and whenever he sits, when he ready to pee, the pee he and the people come together unknown to him. If that part of the fistula can it be treated?
All right. Thank you. Thank you. I can take few more, and we go to our guest to just respond quickly. We leave them. 0886-324740. Good morning.
No?
Morning.
Yeah. Hello?
Please go ahead.
I'm Giuseppe. I'm calling from the southern belt.
Let's hear you.
Yeah, I have my uncle who's calling from the same disease, but we've been to
You say what? You say what?
My uncle.
Eh.
Yeah, we've been to Canada 2 times, but no way. They still continue.
Wait now. Where your uncle suffering from?
This is a same disease, superior. He's sitting by himself.
Oh.
Yeah.
Okay, but
it's 2 times now. No way. No. The treatment it can't hold.
y'all come back. They said the people come here. The people come here on the 11th of this month. So please, if it didn't happen the first time, it can still happen. Just have the hope, yeah.
Okay.
So just make sure that you be there and go through the proper proceedings. And of course, we hope that.
Just 1 second, Chief. But this mission is not for men, so let him be aware. But he
Okay,
can
yeah.
always come. We have a doctor that can look, that can see people with that problem.
Okay.
That men having such problem. We have doctors that can take care of that.
Okay, you heard him.
Yeah, but not this mission.
Not this mission.
Yeah.
Okay, let me take the this person. Morning.
Good morning.
Morning. Please go ahead quickly. Morning. Okay, I don't think I can take any more calls. Let me just go to the guests quickly. That just respond. Then we will get your party comments out of you, and we'll let you go.
Okay. So the next caller talk about family planning. Family planning is a pretty broad issue that we're not discussing it today. We're really concerned with that. That person can always come around. We can ask, what specific questions they have, or we could still find date to arrange, or talk to and talk about family planning. So that would be good. The next person's concern was, what is a GYN specialist? Okay, so GYN is an acronym for gynecology. So that has to mainly do with the pelvis, especially maternal or female pelvis. So any condition therein, so it can be reproductive, with the reproductive system. It can be with the urinary system, the urogenital system, we call it. So that's our main concern. But the full thing is obstetrics and gynecology. So for the obstetrics part, it has only to do with pregnant women. That means, or whatever conditions presented in a pregnant, whatever medical conditions, ranging from high blood pressure, hypertension, diabetes, hepatitis, asthma. So just any medical disease, once the patient is pregnant, is concerned with us. But outside pregnancy, that has to do with another branch of medicine called internal medicine.
Okay.
But for the gynecologist now, it's the pelvis, maternal pelvis, whatever sickness, you have there, that's what we treat. So they talk about hernia. Hernia, again, that's not what we're here. We here mainly for women with fistula, PP and poo sickness. So that we're having surgery on the 11th, December 11th. The screening starts now, as you heard from the PRO. So we have started accepting patients. You can tell your relatives, reach out to your workmates. We started seeing patients now, and the surgery will commence on the 11th.
So finally, Dan, before I take the final comments from your colleagues.
Yeah. We, in closing, let me thank you too for the time afforded us, to reach out to the population. I know this video covers a good, has good coverage. So it's good that we can talk to our people. And then thanks to the team, the foreign team or the international team that is coming from France, the Archimedes. So they're coming too for the second mission after having a successful first mission. So a big thanks goes to them, that we appreciate the offer or the help to the Liberian people, and we encourage them to always come.
Okay.
And pretty much we encourage, lastly, we encourage everybody, because the essence of what we're here is to spread the word. we want it to reach as many people. So there are so many people affected. Sometimes these sicknesses, this particular sickness, you know, is stigmatizing, so people tend to hide. So, but I encourage you, if you hear, come out. If you know a friend too that has the same problem, please reach out to the St. Joseph Catholic Hospital, and we'll be there to help you. Thank you very much.
Okay, Madam, Madam Dino, finally.
Okay. Want to say thank you too for the time. And we also want to say thank you to the public for the cause that is they have been monitoring and listening. And we know that this message will go across. You may hear it and then your relative may not be involved in the sickness. Or when you tell someone, why going to explain to another person? Because this sickness is a sickness that is kept by that person. It's not something like, say, oh, I got this sickness, I got this sickness. No. So maybe while you explain it to someone, or victim maybe that will hear it or know someone,
Okay.
that will be able to bring that person over. And the first mission that we have, we even have people from Grand G there coming, because we got our national midwifery or chapter, and then we got our Facebook page, and when this information can post it, and we'll have patients from there coming.
Okay.
So like what the PRO said is only for them to make the way come, whatsoever money that you spend, it will be reimbursed.
Thank you.
We pray that every one of us will take this signal into consideration, and even the government to continue to train our midwives, especially in the rural area, so that we'll be able to avoid this problem.
Thank you. Madam PRO, finally.
Okay, before I close, I would just want to emphasize on the social and psychological effect of fistula. Fistula is a disease that causes emotional distress, like what all the health people, Dr. Best and Lofty said, is a very embarrassing situation. Sometimes people lose their job, they quit their jobs because of it. Take for example, you are working in an office where you are serving people, a lot of people come into the office and you pee and poop on yourself. You are smelling with pee or poop, you feel so embarrassed. People who suffer this sickness, they isolate themselves. They don't want to go to church, they don't want to go to any gathering. They feel ashamed. Most often, they wouldn't come up to say it or tell somebody, whether a close friend or relative, that I pee or I poop on myself. So we need to do more by sharing the word, so that those who have this disease, the message can reach them for them to come to the hospital.
Okay.
We have this information on our hospital Facebook page. I want to encourage the public to go on St. Joseph's Catholic Hospital Monrovia page and share it to as many groups as you can. Share it on your personal page so that it reach the right people to take advantage of this glorious opportunity. Thank you too to ERPC for granting us this opportunity.
Thank you. And of course, they've been my guest from the St. Joseph Catholic Hospital, Dr. Bess Daba, GYN specialist, Mrs. Lofty, Dino, midwife, and of course, the public relations officer, Ms. Gifty and Gray. They've been my guest on the final lap of the Super Morning Show on ELBC Radio. I will be here tomorrow morning, God willing. That will be 6:30 tomorrow morning. Hope that you had a wonderful time with me on the breakfast program this morning. Thanks to Damawa Fufina, who has been carrying us live across the world on our social media page. Have a wonderful and a God bless Monday from Pennsylvania. Bye bye.